A graft refers to taking a very thin slice of tissue, often skin, or in this case, your nipple areolar complex, and sticking it on to a wound bed. The way it survives is that wound bed that I freshen up, so I remove the skin from that area. It's now a raw bleeding surface, and the little blood vessels from that wound bed grow into your graft to incorporate that permanently in its new location. For optimal healing, this graft needs to stay completely immobile for 5 days so that those tiny little blood vessels can align and reconnect. If in that process there's lots of graft movement, graft wiggle, there's fluid that forms underneath there, there's infection, anything that disrupts the connection of those blood vessels, then your graft will fail and the nipple graft will simply slough off. So in order to maintain that perfect connection of your skin graft along that new raw wound bed, I'll often sew in a bolster dressing that anchors it into position. You'll then come see me anywhere between 5 and 10 days after surgery to remove that nipple bolster and assess how well that graft is stuck on. Afterwards, you still need to be careful with it for about another week. So avoiding any shear force. So when you're showering, making sure you're not rubbing that area, making sure that you have gauze that's just firmly planted on and your binder gently stuck on top so that you're avoiding any additional shear force. By about 2 weeks after surgery, your nipple graft is now secure in its new location. You're not going to have issues with the nipple falling off or shearing off. The coloration of the nipple graft also changes with time. Initially, it's going to look quite dark, quite scabby. I get you to apply quite a bit of Vaseline to help it through its initial peeling process. As it's peeling, it will often then become quite pink. How well pigmented the nipple graft is varies quite a bit between individuals. If at 6 months after surgery, you're unsatisfied with the nipple pigment, then it's a very simple fix with medical tattooing to even out the tone, change the tone of the nipple graft to your desired color.